regulatory group, and then the Pontine group, right? So the dorsal regulatory group controls basically in and out, and the Pontine group controls, it smooths out the rhythm, if you will. So when those centers fire off, they're going to send an impulse down to the external intercostal muscles and the diaphragm, and as a result, that diaphragm, which is in a relaxed position normally, domed, is going to flatten out. It's going to contract and it's going to flatten out. The external intercostals are going to contract. All of that is going to result in an expansion of the thoracic cavity. Inside your thoracic cavity, you have two membranes, one a parietal membrane covering the inside of your thoracic cavity, the other one a visceral membrane covering the lungs itself. And the lungs are very spongy, very elastic, and as that thoracic cavity moves out, it's going to follow the visceral membrane, which is going to expand out, attached to or closely associated with the parietal membrane. Therefore, there's going to be an increase in the volume of your chest cavity. That means that the pressure inside your chest cavity is going to drop and air enters. The same exact process is going to occur when you exhale. However, we have internal intercostal muscles are going to contract. The external ones are going to relax. The diaphragm is going to relax and it's going to return to the dome shape, therefore decreasing the volume of your thoracic cavity, and air is going to be expelled. That's all controlled by the medulla. So here you go. Here's an example of your lungs. We have an open airway, and as the diaphragm moves up and down, air goes in and out. So when we inhale air, we usually inhale through our nasal cavity, and the nasal cavity has some unique structures in it. It has the superior, middle, and inferior conchae. And below that, or inside the nasal cavity, we have a very, very robust, rich blood supply. And as you inhale air, the turbinates, or the conchae, are going to impart turbulence to the incoming air. And that incoming air is going to pick up moisture and heat. You're going to inhale it. It's going to travel down your trachea, your tracheal tube into your lung, and there are certain cells inside your alveoli that produce a substance called surfactant that causes that water vapor to smooth out and lose its tension so that air or oxygen can be transferred across that simple squamous epithelia that is composed, or that the alveoli are composed of, so we can have good gas exchange. If you look right up here, you can see an epiglottis, that's that pink thing. The next piece of tissue that you come across is the hyoid bone, which is right here. This is the epiglottis. This closes off the windpipe from the trachea, from the esophagus. This piece of cartilage is known as the thyroid cartilage, the big one. And right below that, we have the cricoid cartilage. That's represented here. This is thyroid cartilage. First piece of cartilage below that is the cricoid cartilage. Then we have the tracheal rings. Now, on this model, you can see that the tracheal rings on the posterior aspect are patent. There is no cartilage back there. They're open. That's because we have an esophagus back here, and it would be rather difficult if we had tracheal rings surrounding the entire trachea, or cartilage surrounding the entire trachea. It'd be difficult to swallow. Besides that, we don't need protection down here or back here because we have a spinal column, right? We have a bony spinal column. We need that cartilage to maintain the patency of the airway, or else every time we tipped our head, if we didn't have cartilage, that airway would close off. So the trachea divides into a primary division feeding the right and left lung, then secondary divisions feeding each lobe, and there's going to be progressive diminution of the airways until we get right down to an alveolar sac. The alveolar sac is made up of individual alveoli, kind of like a bunch of grapes. And each one of those little grapes has two types of cells in it. It has type 1 and type 2 cells. Type 1 cells produce ACE, angiotensin converting enzyme that controls blood pressure. Type 2 cells produce surfactants that reduces surface tension of water. Over each alveoli, we have a capillary network, because the capillary network is necessary for picking up the oxygen and disposing of CO2. This is your tongue. What else do we have here? The rest of this material, lung, heart, etc. Any questions on this?